The report for today is as follows. We had 634 new cases and 16 people have lost their lives. Total number of active cases in the state as of today stands at 4,915. I would also like to inform you that the testing also has been maximum this month. We are close to touching 50,000 tests, today being the 17th of May. Last month, in the whole month of April, we touched 60,000. So we expect that this month of May, we should be touching a total testing of 70 plus thousand, maybe touching 80,000 tests. I would also like to inform you that in the last 1 month, after a lot of work that has been done by the officials, the health department and the government together, we have been able to expand our oxygen supported beds from 350 to 750 today. And we are hopeful to expand that to 1,000 oxygen supported beds in the next 2 weeks. When we started off with the second wave, we had approximately 700 oxygen cylinders. Today we have doubled it and we are close to touching 1,500 oxygen cylinders, and we hope to increase many more in the coming days and weeks. I will be informing you about those at a later stage. We had Civil Hospital, Nazareth and Negrams having some kind of storage or oxygen plants or generators. But within the next few hours and in the next few days, we should be upgrading the services in Civil Hospital Shillong and in Ganesh Das Hospital, as well as in RP Chest Hospital. So we'll be having oxygen plants in these 3 hospitals very, very soon. Upgradation in Civil Hospital is going on as we speak. Also, within the next few days, maximum a week, we will also see the oxygen plants in Tura, Jawai and Nongpo Civil Hospital also be completed. After that, in about 2 weeks' time, we are scheduled to also complete the oxygen plants in Nongstoin, Williamnagar, Bakmara and Ampati. At this point in time, I would also like to inform you that government has decided last week to start some form of Corona care centers, Corona isolation centers, whatever nomenclature one would like to use, in different cluster-based units in different parts of the city. And this is anticipating that we may require more beds. We are trying to increase the presence at the locality level so that certain cases which may not need full medical attention or full hospital services could also be supported through these different centers that will start at the community level, and this will be supported by the government, where we will put basic manpower in these centers also, and we'll also be supporting them with oxygen concentrators so that those patients, as I mentioned, who don't need full medical service of a hospital can also be given a bed and given the basic support in these locations also. So roughly about 300 such beds will be created in the next few days in different parts of the city with the help of the community. And at the same time, we are also working very aggressively. We have already almost completed the beds in 300 beds in IIM, and this is the old campus, and the Marti about 100, and third one was and NIFT also 100. We are also looking at supporting these centers, at least 50% of these beds with oxygen concentrators, so that in case there are patients who require basic support of oxygen can be given oxygen through these centers also. We could see a scenario where we would touch 5,000. And that's the reason why, even before we reached it, we realized that the momentum of this virus is so strong that we need to take decisions way in advance. And that's the reason why, even though we were nowhere close to 5,000, we took the decision to lock down Shillong and East Khasi Hills and put very strong restrictions in many districts. In spite of that, we still reached this position. So if we had not done what we did 2 weeks back, situation would have been much more complicated than what we have. At the same time, because we anticipated the way the things were moving, seeing what happened in the rest of the country, we realized that we would need more manpower, we would need more hospital beds, we would need more oxygen, and therefore we started the entire preparation for this moment which you're talking about. And so that's our preparation started almost 2 weeks, 3 weeks back, and that's why these restrictions were in place. But yet we were not able to slow down the spread of the virus. So there are many factors for that, and we need to realize that government will put restrictions, but even at individual levels, we need to ensure that we follow our protocols, even at home. And that's the reason why this whole week, you're already aware, we'll be coming out with very strong sensitization program and a complete media campaign on how we should have our behavioral change even at the household level to ensure that we contain this. So yes, you're right. We had always looked at this 5,000 number and we prepared for this in that line. But it is very important to realize that if the numbers keep growing, no matter how many hospitals, beds, or oxygen cylinders we get, we will not be able to make it sufficient for everybody. Therefore, the containment is the most important strategy. Rather, we should say this is not even containment is a very kind of negative word, but this is the only precaution, I should say, that we can take. So we have to be very careful and ensure that we maintain our restrictions that we have right now, and hopefully we'll see that in days to come that the numbers will start to plateau, and hopefully very shortly we should be able to see numbers going down. But it's difficult to say right now. I cannot predict anything, but we can hope that it will happen, and for that we need the cooperation of the people and the society at large.